Let's find out what's happening on ground. Our correspondent Naba Mohideen joins us now in Port Sudan. Naba, great to have you with us. What more can you tell us about what's happening so far, especially about the cholera as well as conjunctivitis outbreaks that are currently going on?
Actually, cholera is one of the diseases that Sudan right now is suffering from an outbreak because of two reasons or two main reasons. One of the reasons is the contaminated drinking water and also the bad weather conditions. Other diseases like malaria, watery diarrhea, and measles. So the situation is really bad. Cholera outbreak is now uncontrollable because the floods, the unseasonal floods right now are cutting the roads leading to the most affected people in northern state and also in eastern Sudan, Kassala and Al-Gadarif state. The situation is bad and the number of affected people and people who died, it's believed to be higher than the Sudanese Ministry of Health reported, because right now the Sudanese ministry said 22 people died because of the cholera, while the WHO confirmed that the numbers are 316 people died from the cholera outbreak. So there is no mechanisms or ways to even track the real numbers and affected people because of the fragile situation, because of the people who are right now suffering from the devastating floods in different places. They can't be reached by the international organizations or by the Ministry of Health. So the situation is uncontrollable, and the outbreak is another risk and another burden for millions of people who are already in very vulnerable situation.
Well, on that note, Naba, then what has been the ongoing response so far, especially to deal with the cholera outbreak, either by the government or humanitarian organizations, the WHO, and what are the challenges from the ongoing conflict?
One of the huge efforts made by the international organizations and by the government in coordination with international agencies is to reach people who can be reached, especially in eastern Sudan and some areas of Khartoum state. Some people right now are supplied with life-saving medicine, with tents, with mobile health units. So the international organizations are making huge efforts, especially in safe regions in Sudan, but the challenges remain. The first thing is the floods. Right now is cutting main roads, so it's not accessible. The other thing is the conflict itself. It's of course, it's a big challenge for international organizations and government to reach people in need, especially in Al Jazeera, in Khartoum, and areas controlled by the RSF. We are very hopeful that at least humanitarian corridors will be opened for the reasons of helping vulnerable people who are suffering right now from outbreaks. But the challenge remains the fighting itself, which covers right now about 80% of the Sudanese lands. But the international organizations and government are making huge effort to open humanitarian corridors, even if the two warring parties have not agreed on ceasefires or humanitarian ceasefires. But we are expecting that they will open humanitarian corridors so they can deliver aid and medicine for hundreds of thousands of people.